And welcome back. You're still watching It's a Beautiful Day. This is Weather HQ. Now, as we mark World Blood Donor Day on June 14, we honor voluntary donors and highlight the need for safe blood. This year's theme, Give Blood, Give Hope, Together Save Lives, reminds us that each donation can save lives. Joining us via Zoom is Ms. Gwen Pang, the Secretary General of the Philippine Red Cross, to talk about the campaign and how Filipinos can get involved. Magandang umaga po, Ms. Pang. It's a beautiful day. Thank you so much for joining us.
Good morning, Paolo, and good morning for having us in your program. And advance Happy World Donor Day.
Yes, advance Happy World Donor Day as well. So, Ms. Pang, let's talk about that first, because the significance of World Blood Donor Day, why it remains such a vital observance globally, especially here in the Philippines. Just how much blood do we need? Is there a shortage? And at the same time, is there too much blood? Is there such thing as too much blood?
No. Okay, thank you, Paolo. Well, World Blood Donor Day is being observed annually every June 14. So it serves as a awareness raising for the public about the need for blood donations, and to also celebrate the efforts of our voluntary blood donors, who we owe so much, because they have given so much of themselves for others may live. So this observation is critical globally, as it emphasizes the importance of blood donation in saving lives and improving health of the people who are in need of blood. Now, in the Philippines, as you have asked, do we have enough blood supply? No. So the WHO, or the World Health Organization, the formula of targeting how much blood do we need per country is 1% of the population. So now if we have about 112 million, 215 million population in the country. So that would mean that we need about 1.1 million bags of blood. Philippine Red Cross, as of last year, we have collected over 550,000 bags of blood and benefited over 300,000 patients nationwide. No, it means that this makes the Philippine Red Cross as the main blood source in the country, majority blood source in the country, as a single organization. And the rest of the blood, they come from private hospitals and also our government hospitals. So do we have enough blood? Well, as far as the Philippine Red Cross is concerned, we're trying our best to really supply the blood demand for the country. So, but since we don't have the statistics or data of the entire country as of today, we only have Philippine Red Cross data. So far, we still receive a lot of requests. We receive a lot of requests every day.
Yeah.
No? And then there are rare blood types that we have to search every day. Dumadami. They're even becoming more and more demand for Rh negative blood type. No, so we have two blood categories. No, we have Rh negative and Rh positive. Both have AB, and O types.
Yeah.
So the areas in the Philippines, actually the Rh negative blood types. These are most likely are blood types of was these foreigners, especially Caucasians or of European, Europeans, no. But every day we have been receiving requests for Rh negative blood now.
Really?
It means maybe dumadami na rin ng Rh negative people who have Rh negative blood type in the country, and this is so difficult to find because we only have less than 1% of the population in the Philippines who has Rh negative blood types.
Oh, that's so interesting.
We still need that. And then, of course, whoever is listening and whoever would like to help us campaign for this, we're campaigning to build the roster of our Rh negative blood donors in the country so that we can easily access them in case there's a need for blood. And normally we don't bleed, we don't take blood from the Rh negative donors, because we reserve that when when the time will come that we need the blood, because for conventional way of giving blood, we can only extract once every 3 months from donor. Yeah.
Wow, that is very interesting. Rh negative in particular. You issued the call just now for those Rh negative to be put in the roster. How do they go through that process? And of course, for those who are not Rh negative but do want to give blood, what process can
So
they go through? And of course, what activities do you have to get
yeah.
people into volunteer?
First, they can actually call our hotline 143 to give us the details that they are Rh negative blood type, and then we put them in our roster. Or number two, they can also go to the nearest Red Cross office in their area. By the way, Paulo, also with dengue cases arising, no, especially during rainy seasons, blood demand is even more higher, especially for platelet blood components. It is also the same with the patients with having cancer conditions. We are also receiving a lot of requests for patients who are in need of blood that are diagnosed of having cancer, like blood cancers. So we also continue to give them blood, and also those patients who have kidney diseases that need to undergo regular dialysis procedures. So these are, it depends on the season, depends on the situation. But we always in need of blood. And, with the increase in population, increase in the also technology, in the medical sciences, all the more we are seeing the increased need of blood.
Before I move on to talking about the strategy of getting more people in to donate, I want to ask about the health screening process because not everyone could be donors because of X or Y factors. Can you tell us a bit more about the screening process to ensure that the blood donated is safe and, of course, usable for those who really need it?
Yes. So, well, what's the process that you have to undertake? Number one, we help prepare the blood donors, no, who will come for blood donation drive or on their regular blood donation day. So, what we have to remind them is number one, they have to have the age, no, it must be they must be 18 to 60 years old or 18 to 65 years old. 18 to 60 years old if they're not a regular blood donor, but 18 to 65 years old if they give blood regularly. That means that it's 3 to 5 times 3 to 4 times a year that they give blood, or every quarter. So then they qualify to reach until age of 65 years old. Now, can 16 years old give blood? Yes, provided they have parents' consent. So if they have parents' consent, then they can come and give blood. And for minor age group of 16, you can already give blood for 16 years old. Then, of course, you have to have enough sleep, at least 5 hours. No alcohol drinks, or you have not taken any alcoholic drinks, the day before the donation. And then you can donate even if you're hypertensive or if you have diabetes, provided on that day of donation, your diabetes and hypertension is actually controlled. So if it's controlled, then you can actually give blood. And but for dialysis, for patient with what's this with diabetes, if you're already taking insulin, we cannot take blood from you unless kung medication lang, it's okay. And then also before donation, avoid heavy meals,
Yeah.
and then or oily meals, and then that's all. And then the weight, no, it should be at least 110 pounds for Filipinos. So that is the requirement, no. So the whole process is very easy. So it's actually almost free checkup for those blood or blood donors, iba. So when they come, we check their health condition. So because only healthy individuals can donate blood. So we check them physically, and then we also have questionnaires for them to answer. We weigh them, we check their hemoglobin, if they can give blood on that day. So hemoglobin is very important because that measures also if you have enough oxygen in your blood, and that hindi ka puyat. So if we check on your hemoglobin, if it will not float, it's heavy, it will sink, to the bottom of the testing jar that we're using, then you're okay. So
Okay.
that's the only thing. And then you get a free medical checkup. So, and then if in the event, no, you are tested positive on any of the five transmittable diseases, we will notify you. And
Oh.
these are all confidential. These are all handled very what's this? Yeah, sensitive and careful.
Discreetly. Yeah.
discreet and also confidential. So we will notify you, and then you will actually be given a free counseling and also free referral to some of our partner organizations or hospitals.
Ms. Pang, that sounds great, especially the whole free checkup. And syempre, some people might just be going there to donate blood, but then find out that they do have to address a certain issue. So that is obviously going to be a big help. We're running out of time, but very quickly before we go, there are programs being done by the Red Cross, especially for World Blood Donor Day. What effort is there to get more people in to donate?
Well, we always keep a list of our blood donors, voluntary blood donors. This is the best thing in the Philippine Red Cross because we only extract from volunteer blood donors. They're not put under pressure. It is need driven by anyone. It's just from their own personal volition that they really want to give blood voluntarily. That's the beauty of it. No, so we always cover the different sector in the communities to give blood. And for this World Blood Donor Day, we celebrate it together with with DOH. So actually today, there is a conference in Iloilo that is attended by different blood service practitioners. And tomorrow we will also have a fun run in Iloilo. So they chose Iloilo this year as the venue of choice for the World Blood Donor Day celebration. There's a lot of activities. It depends on the organization.
Okay.
So, but for the Philippine Red Cross, we're doing it actually big time next month in July because the whole month is actually the Blood Donor Month celebration.
Thank you so much, Ms. Pang. Hopefully, we can get more blood donors. And thank
Yes,
you for your
please.
time, your insight, and
Thank
of
you,
course, yung
Paolo.
commitment po ninyo. Maraming salamat po.
Thank you.